Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and before we pick up Terrence, you wanted to make some announcements, Dr. Darrow?
I do. Thank you for holding with us, Terrence. I'll be with you in just a second. I have a free book here for you, $25 value that I wrote. Took me 5 years to put it together. It's got 264 studies in it on how regenerative medicine of platelets and stem cells works, even though the orthopedic surgeons don't think so. I don't think surgery works. We're all entitled to our opinion. And this book is worth $25. I'm going to give it to you for free, mail it for free. If you want to call me right now at 866-870-5752. That's 866-870-5752. And if you want to call me at the office to get more information, the phone number to the office is 800-300-9300. If you want to email me, go to the website. There's a spot on every page. And the website is www.lastemcells.com. Terrence, you've been very, very nice to me by waiting. How are you today? You have a knee problem, huh?
Yes, I do.
Okay.
I had in 2018, I had so-called meniscus repair.
Okay.
They showed me the pictures showing how
Sure.
it looked like a feathered.
Sure.
It was all shredded and feathered, so they went in and removed the damaged material. But I was on the impression that it was a repair, but of course it's a removal, not a repair.
Yeah.
So sorry.
No, go for it. Go ahead. I'm listening.
Okay. On the inside of the knee is where I have the pain still.
Okay, that's called medial. In medicine, we call that medial. Middle is medial. The outside is lateral. So go ahead. You had a medial meniscal tear. You had it repaired in 2018, but it wasn't a repair. It was a clean out. Correct?
Yes.
They just shaved off what looked like the feathers of cartilage.
Yes.
Okay. And how are you doing? How is it doing today?
It still gives me the pain. If I don't wear a sleeve on it, it gives me pain.
Okay.
If I do a lot of walking, and so sometimes it's fine, and then other times I get that constant nagging pain, like a little fire sticks inside there or something.
Oh, I bet. Yeah. Let me ask you a real bomb question. Did the surgery work?
I would say that no. Because,
Okay.
I have it. That was the only part of the knee that was hurting me, and it's the only part of the knee that still hurts me today.
Okay. So let me tell you about studies that have been done about that. Studies on that particular procedure were done, they're done all over the place, with what we call a sham surgery, a fake surgery versus a real surgery, comparing the results, okay? And the Veterans Administration did one of these giant studies, and they found out that people get better after 6 months after a fake surgery versus a real surgery. That means that if you had your skin cut just on the surface and you didn't know if it was real or fake, and it was a fake one, you got better than the people that got the surgery, the real surgery. Okay, that's what I've been preaching to people for the last 25 years. And a lot of orthopedic surgeons don't like me because of that. That cuts into their bailiwick of work. Now, I like orthopedic surgeons. I love them. They do really the toughest work in medicine as far as I'm concerned. Physically, it's very, very demanding.
I agree. I mean, he's a great surgeon for fixing bones. He's done over the years, too. So, yes.
Yeah. So, to get into orthopedic surgery, you have to be the top of your class. You got to be smart. But in my humble opinion, they shouldn't be doing these surgeries. Okay? Way too many surgeries are done on people that don't need it, that could have been healed by an injection of their own platelets or stem cells. How do I know? Because I've been doing this for 25 years. That's how I know. It's my experience. Okay. Could I be wrong? I could be wrong. It's just my experience. And, you know, I tell the story in every show. I had a shoulder surgery when I was in med school. I was very hyped up about becoming an orthopedic surgeon. Had my boss do my shoulder, had a weightlifting injury, and it got terrible after that surgery. That was a wake-up call for me. And then about 4 years later, when I was in my residency at UCLA, a doctor came in and said, I heal 80-90% of my patients using regenerative medicine. I went to his office and I talked to his patients. He was right. And then I was like, I'm not going to do surgery. I'm going to do this stuff. And that's what I've been doing ever since. So, you know, I don't put down surgeons, but I do put down the surgeries they're doing, if that makes sense.
Okay.
So
yeah. I understand what you're saying. My question also is, since they remove part of the meniscus, the platelets our stem cells or whatever, would help to regenerate some of that cartilage again?
Absolutely. The question is, are you going to feel better? The question is not, is it going to regenerate?
The only place I have the pain is on the inside there.
Yeah. All I can tell you is I do knees every day, probably more knees than any other part of the body for some reason. But I do everything. I do the whole body, you know, from head to toe and everything in between.
I mean, I've talked to people who've had knee replacements, and some of them are happy. A lot of them are not happy with it either. So that's not even on the table. So
yeah. So that's really the problem with surgery. Surgery is really it's like going to Las Vegas. It's a crapshoot. You don't know how you're going to come out. There's a lot of terrible side effects. It's a very invasive thing to do. There's a lot of infections. I've seen knees that are cleaned out. And, you know, that's a good point. You had a clean out where they just shaved everything down and took out the good tissue. I don't think it's a problem having that feathery tissue in there. Okay, I think it's good cushion.
Yeah, because I may have had it for 30-plus years at that time, because I broke my leg and my ankle and probably damaged my knee cartilage at that time, too.
Probably so. And what happens is very commonly people will have something that a surgeon would want to operate, but they don't even know they have it. Okay, as we get older, I don't know what the exact statistic is, but I think by the age of 50, most people have a meniscus tear who are active, okay? So these are just parts of the body that wear down with exercise or motion. Like a car, you don't throw the car out or operate on it when the tires wear down, you know? So these are all things that can be regenerated. And the question is, can I help you by doing this? I think so. I can't promise anything to anybody, but most people get better. That's all I can tell you. Most people get better.
The same thing. He couldn't promise me that it would get better either. So yeah.
Well, that's a good thing, because then that's a surgeon you can trust. Because most surgeons that operate on the people I see have told the person it's going to work, not that it might work. So I like your surgeon. I just didn't like that he did that surgery on you that didn't work. You know, now your knee is more unstable. You have less tissue in it to protect the joint.
Yeah, I think that's correctly true. Yes, what you said. Then I have one other small question. I have a brother who has 2 torn rotator cuffs.
Okay.
One on each side because of all the work he's done on his shoulders.
Sure.
He's been talking about coming down. He lives in Idaho, to come down and have you do a consultation and maybe have repairs. The same thing.
Yeah. I'd love to see him.
Okay, because he's the same thing. He went to his orthopedic surgeon. The first thing out of their mouth was, "Well, you need to have those both repaired." And he says, "You know, I function pretty good with them the way it is." He says, "Yeah, there's a little pain if I do raise my arms too high, but overall," he says, "I don't really want to have all the surgery that they want to do."
Sure, I get it. Well, listen, like I said, I had the surgery a long time ago, and it made me a lot worse. I had a swollen arm and a high fever afterwards, and that was my wake-up call that surgery, even though I love doing surgery, my God, it's so fun. I can't tell you how much fun it is. Seriously, it's like the most fun thing on the planet to get in that operating room and have the rock music blasting, and you just feel like you're the stud of the earth. But you do. It's just it's a great experience. Open up the body, sew it up, cut it out, and then you think everything's perfect. But unfortunately, I don't see it that way, and I didn't see that happen with patients. I'll tell you a story that was absolutely awful. I was doing in medical school research on back pain, and it was with surgical fusions. We actually put metal between the vertebrae to fuse it.
Uh-huh.
And I was with my professor walking down the hallway of a hospital, and a man limped over, and he said, I won't say the doctor, I will say it. He said, "Dr. Gordon, you're the greatest surgeon on the planet." And then he limped away. And then I got in the elevator with Dr. Gordon, the door closed, and he said, "That guy is full of it." He said, "I ruined his back for him. Did you see him limping?" I said, "Yeah." He said, "I did that to him." And I was like, "You're kidding." He said, "No, I'm being honest. He was a lot better before I met him." And,
wow.
Yeah. He said that he put a screw through a nerve that went down his leg. There's human error in surgery.
Yep, that's true. I mean, surgeons are human just like anyone else.
That's right. And at least with doing regenerative medicine using platelets and stem cells, PRP and stem cells, you're just injecting. You're not cutting the body open. Can you screw up with a needle? You could. I think it's 0.03% sequelae, meaning things bad that happen doing injections, but with surgery it is much higher than that. We all know people that have had surgeries that have gone bad, and I'm the living case of that.
I would say the same thing, that it didn't work 100%.
So there is a huge probability. I'd have to examine you to see, but from when you're talking about you're active and all that, it's real high percentage that you're going to heal by doing regenerative medicine, stem cells, or PRP, or both together.
I will make an appointment to come in and talk to you in the office and have a consultation. I'm
going to throw out the number again for everybody at the office if they want to call the office. It's 800-300-9300, or repeated 800-300-9300. And if you go to the website, you can actually watch me doing these injections. There's a lot of videos, and that website is
I have. And
I'm sorry?
I'm impressed what I've seen, so yes.
Well, I'm giving out for everybody else, though. So
I know I'm saying that I have gone and looked at that, and I've been very impressed with what I've seen. So,
well, thank you. The other thing you'll see on the website with these videos, and again, the website so other people can hear it, is www.lastemcells.com. I use ultrasound to get into the joints. The studies show if you don't use an ultrasound, if you do what's called a blind injection, like most orthopedic surgeons do, you're going to miss the joint at least 1/3 of the time. Okay? So that means 33 out of 100 shots are not going where the orthopedic surgeon thinks it's going. Now, a lot of people use things like hyaluronic acid to lubricate the joint, and a lot of people end up with an incision and drainage because that stuff didn't get into the joint. It goes into the soft tissue. I'm not a fan of hyaluronic acid because when we do regenerative medicine, the joint automatically produces hyaluronic acid. There's brand names like Suparts and Synvisc and things like that. Why do you need to lubricate the joint if there's already fluid in it? It doesn't make sense to me. I've used it. It didn't do anything. I know it works on some people for a while, but a lot of people that come into me have had that done and it didn't work. So that's not what I do. I want to regenerate. I want to heal. I want things to be natural. Okay? So Terrence, thanks so much. We've had Carrie waiting for a long time. And God bless you. And we'll go to Carrie. And Carrie, I'm reading. This is Dr. Marc Darrow, by the way. Are you still with us?
Okay. Yeah.
Okay. So tell us about your knees. What's going on?
Well, I have, I was diagnosed a while back ago, but I believe in the alternative approach, and that's what I've been trying to do. I have, they say I have lupus, connective tissue disorder. It's been labeled all kinds of different in the systemic inflammation. And I was just wondering, because I've been struggling for now going on 2 months with inflammation on both knees, and it's very difficult to bend my left knee.
Okay.
And I'm using crutches to get around just to, because it's difficult to walk. And there's swelling on both. I have swelling on both. But I was just wondering, I've had stem cell before. It was costly, but it was a blind stem cell. It was done by an orthopedic. It was blind stem cell.
Blind meaning no ultrasound to guide it?
Correct.
You don't even know if that went into your knee joint.
So, correct. And then they did the IV, too. This was many years ago. This was... I did it with my son, probably from a doctor up in L.A., but it was probably about 15 years ago. Okay. So I'm just wondering, my basic question is, does it help systemic issues?
Does it? You mean stem cells?
Stem cell and PRP.
Here's my experience with it. I've left the country to go get embryonic stem cells probably 25 years ago. All right. In Eastern Europe, they don't really use birth control. They just do abortion. So there's a plethora of it's sad to think about, but there's a plethora of babies that are born, and then they take the stem cells from them, from abortions. I didn't go there, but I went to the islands off of Florida to do it, and it's illegal in our country to do that. But when I had it done, it did nothing for me. Zero. Now, I do have friends in America who use the stem cells IV. They all tell me the same thing. If you have autoimmune disease like you do with lupus, it can quiet it down for a few days. Does it fix it? No. I don't do that. I don't do any IVs. So I don't have the experience. All I have is what other doctors who do it tell me. We will at some point have stem cell lines that are being developed by university centers and companies now that will heal everything. But it's not here yet today, I'm sorry to say. We're working on it. The injections into the joint can be helpful for orthopedics. Are your knees warm or just swollen?
No, they're warm. I get cryotherapy done. Okay. And that seems to calm things down. Okay. I see it actually get calmed down and less swelling when I'm having the cryotherapy done.
Okay. Well, there are things that can help you, and I think the best thing to do for you to start a relationship with me, because a lot of things that I don't really have time on the radio to talk about. If you go to www.lastemcells.com.
I wrote it down.
Okay. If you email me from there, I will call you and give you a lot of information that can help you, okay?
Okay, that sounds great. Thank you.
Yeah. All right. I would stay away from the IV stem cells at this point. If I find out tomorrow that there's a line that's been developed specifically for what you have, I will let you know. But as of today, I don't know of such a thing. Okay. And again, I'm going to repeat it. I don't do IV stem cells. It's the FDA would not like me if I did.
Okay. I appreciate everything. Thank you very much.
And I haven't heard from my doctor friends that do it that it's of much value, if anything at all, other than placebo. But injecting into the joint with your stem cells, I think, may be a great idea. Okay? So get a hold of me through the website. If you want to call the office, the number there is 800-300-9300. And I'd love to see you and examine your knees and let you know what's going on. I don't trust anybody else's diagnosis, I'm sorry to say. I've treated tons of people that say they have lupus, and they never had lupus to begin with. And it's having an autoimmune disease is something that rheumatologists like to throw at people when it may not be that. The other thing is your diet is super important, Carrie. You've got to try this at least, an alkaline diet, and see if you can get those knees quieted down. That usually will do the trick.
I'm away from the nightshades. I've been away from them.
Now, this is different than that. This is alkaline. Okay? Alkaline.
Okay, I'll look it up.
You can Google it and take a look. You may not like it, but do it whether you like it or not.
Okay.
All right?
Okay, I appreciate your time, Dr. Darrow.
All right. God bless you, Carrie. There's good hope ahead for you.
And would you like to talk to Dr. Darrow? If so, that number is
866-870-5752. I'm going to give it out again while you scurry to get your pens. 866-870-5752. You can call me right now. I want to talk to you. I want to help you with your pain issues for the musculoskeletal system, joints, ligaments, tendons, anywhere around the body, head pain, neck pain. Sometimes we can get rid of headaches if they're coming from the neck or the back. A lot of them are coming from there. I used to have those. Those are gone. I've had many miracle headaches cures where people were taking all kinds of medicines they didn't need. End of the show. Nita Valens, God bless you, and the staff, Suzette, Alex, and we'll talk to you soon.
And remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. You've been listening to Living Pain Free with Dr. Marc Darrow, and we will see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.